Hello everyone, my name is Jonathan Cerezo and I'm here to present to you today a patient safety issue that I'm working with at Henderson Hospital. And it's called the Handoff Checklist in the Perioperative Area, a patient safety guideline. Imagine yourself having a carpal tunnel release. You checked in the hospital and the pre-op nurses checked you in to get ready for surgery. The surgeon comes in and he asks you, do you have any question? Well, without any knowledge of medical jargons, you just said, no, doc, just take care of me. After an hour, when you woke up, the surgeon approached you and he said, I'm really, really sorry. And you wonder, why? What happened? Instead of a carpal tunnel, he amputated your thumb. What do you do now? Do you have anybody to blame? Or is there any break in the surgical process that needs to be addressed? These are the type of questions that will help us understand the benefit of having a handoff checklist in the perioperative area. All right, what is a patient handoff and why it's important? According to Canali, patient handoff in the perioperative setting is the transfer of vital patient information from one caregiver to the next. An example of this is if a patient has a latex allergy, the pre-op nurse must communicate that information to the operating room nurse. So the OR can use a different type of latex-free gloves during surgery. Identifying the problem. So during the handoff reporting, there's a high chance of medical error or sentinel event regarding the patient information being transferred. There are many barriers that contribute to this issue, such as noise, interruption, language barrier, and time. Here are some facts. According to the Joint Commission, approximately 80% of medical errors are due to communication failure during the patient transfer process. And also, incomplete report or handoffs can be attributed to 80% of preventable errors or sentinel events. Handovers between anesthesia providers increase the risk of mortality. So, reporting and all the vital patient information must be accurately transferred to another healthcare provider. All right, so what type of information that needs to be transferred? Let's begin with the three different areas in the perioperative setting. First one is the preoperative area. This is where the patient checks in. Intra or interoperative area is the operating room. The post-operative area or the post-anesthesia care unit is where the patient recovers. So let's begin with the pre-op area. The information that needs to be collected are patient's name, date of birth, MRN number, allergies, NPO status is very important. Correct procedure that we're doing, if there are consents to be signed, that needs to be done there. In the operating room, all the information collected in the pre-op must also be transferred into that section of the perioperative setting. And we can also add, do they need antibiotic? What type of anesthesia they need? Also, if they have taken any aspirin, and if they need any special graft, implant, special trace, that needs to be talked about before bringing the patient in the OR. After surgery, the patient is dropped off in the PACU, and all the initial information that are collected from the two initial departments needs to be transferred, and also we can transfer information, what type of medication and the amount used during surgery, if there are blood loss and also urine output, if they need redosing of antibiotic, and also is there any change in the current health status of the patient during surgery, and is there any additional surgical procedure done. All right, the current status of the handoff tool that we use right now is, I don't know if you guys can see this. This is very detailed. It talks about allergies, NPO, antibiotic history. But the problem about this checklist, it only works around the operating room. My ideal handoff checklist works beyond the OR. I'm planning to use one sheet for one patient that can follow a patient throughout the surgical process. All right, let's talk about the literature review number one. It is called the clinical handover of immediate post-operative patient. So the purpose of this is to establish a scope of clinical handover between the OR and the PACU. And the method used is a quantitative research method, and they scrutinizes the standard of practice within the past 10 years and identify if there are any weaknesses or any change that needs to be done. The result, the clinical handover is very vague, very casual, and also informal. And the information that are being collected are inconsistent, unstructured, and disorganized. And conclusion, they recommend to create a training and education strategies to strengthen collaboration and teamwork between the department. Literature number two is where I base my proposed handoff checklist, and it's called the Handoff in the PACU, the use of a checklist for transfer of care. The purpose of this study is to determine if using a checklist can decrease information loss during handoff communication. And also the method that they use is a qualitative cross-sectional research that encourages the use of a checklist during communication, handoff communication. And the result is the use of a checklist lowered the rate of callbacks for clarification between anesthesia provider and the RN. And the use of a checklist during a handoff can help providers correctly exchange information and thereby increase the adequacy and accuracy of the handoff. So comparing to my proposal and the two literature review that I talked about, the new evidence-based handoff checklist provide a structured process to the staff, a tool that help them collect all the data and communicate that to the next healthcare provider. And the use of a checklist prevents nurses from reporting inaccurate patient information to another healthcare provider. And the new handoff checklist eliminate missed informations and medical errors due to distraction and barriers that we talked about earlier. All right, my goal is this sheet. As you can see, this sheet is divided into different departments. Like what I talked about earlier, one patient, one sheet that can follow the patient throughout the surgical process. Especially if the patient is being transferred to med-surg or another unit, this will be helpful. All right, the benefits of new handoff checklist. The focus will be on the patient. It provides nurses versatility of having the computer system and also the handoff checklist paper sheet itself. It creates face-to-face communication. It prevents the feeling of being rushed. It develops trust between the healthcare providers, and also it improves patient safety and staff satisfaction. All right, how do we get there? So this project is scheduled to be done within 7 weeks. Each week is assigned a special task. And also the major players are the change RN, the champions, the stakeholders, and the leadership. Specifically, so the change RN and the champions will identify weaknesses on the old handoff checklist and use that information to create the new handoff checklist. The stakeholders will be the one who's going to be using the new checklist and identify any improvement on that. The leadership will provide guidance and resources to the change RN. All right, the result. Unfortunately, the final approval was delayed by corporate. They told me that this type of change will take about 8 to 10 months or even a year. But they gave me permission to use the new handoff checklist alongside with the old checklist. And we caught, within that time frame, we caught one possible latex allergy that was identified by the new handoff checklist and not identified in the computer. And also the turnover time in the OR improved from 8.5 to 7 minutes. And patient and staff satisfaction was accounted for through the follow-up survey that we done a few days ago. All right, here are my references. If you have any comments or questions, just leave it on the comment section below. And thank you for your time. I hope you enjoy my presentation.